enlightening and insightful episode of Me and My Health Up. I'm your host, Anthony Harcher. I'm a clinical nutritionist and lifestyle medicine specialist. Today, we have a very special guest. We are talking about music therapy and music therapy for mental health, music therapy for anxiety, depression, Alzheimer's, dementia, Parkinson's, and victims of stroke. This episode is all about how music therapy can be applied to empower these people with these mental disorders. And so I'd love to welcome on the show and introduce you to Dr. Tanya Silveira. So Dr. Tanya Silveira is a registered music therapist. She has a bachelor in music and arts and another bachelor in psychology. And she went on to do her PhD in applying music therapy for the stroke victims and how music therapy can be applied to those that have suffered a stroke and how it can really help them in their rehabilitation. And so I really look forward to you joining me with this discussion, and we explore how it works and who it's for, and just the intricacies around how music therapy really helps someone get back their full functionality. And it's a really intriguing episode and really enlightening in that sense, because it will open you up to another paradigm beyond the talk therapy for mental health. It opens you up to a whole new world of music therapy for mental health. So without much further ado, I'd love to welcome you into the discussion I'm having with Dr. Tanya Silveira. Welcome on the Me and My Health Up podcast. How are you, Dr. Tanya Silveira?
I'm pretty well, thanks. Thanks so much for having me.
It's such a delight to have you on. I've been working on this one for a couple of years now, I must say. So it's
we got there.
It's great to have a very in-demand guest, and and that's what I'm really excited about today, is to have your specialty on the show. I've never interviewed a registered music therapist, and so you're the first, and I guess that's special for me. And you come with such high regard. So all your authored papers, co-authored papers, and your breakthrough research and your TED talk, it's really special. So before I let the cat out of the bag, or the rabbit out of the bag, I'd love to give you the opportunity to share with the listeners as to how you have arrived at what you're doing today as a registered music therapist.
That's a really great question, and I guess my response stems back 20 years maybe. I guess I'm in that age bracket now. When I was 15, my brother was looking into different courses for him to do in his, university life, and we decided just for fun to see what might be interesting for me, and we came across this profession of music therapy. And 5 or so years later, after finishing my undergraduate, I still wanted to do it, and then I engaged in the Masters of Music Therapy. So I felt it was pretty amazing to be able to combine my passion of wanting to, I guess, help people, as cheesy as that may sound, and also combine that with my love of music. So I feel very, very fortunate to be in a profession where I just enjoy how everything kind of comes together.
Absolutely. So every day that you get up, you don't feel like you're working, right? You're just doing something that you love doing.
I mean, there are, of course, some challenging days, of course. You've got to love those bureaucratic systems that we work within, and some challenging, I guess, case stories of people that we work with. But ultimately, I feel very privileged and really excited to do what I do, and I feel constantly inspired by the music therapy participants and patients that I work with. So, I feel pretty lucky to be working in this kind of a profession.
Fantastic. And your love of music, is it because you play a musical instrument, or is it you just love listening to music and moving with the beat of music? What is it?
I think it's a combination of a lot of factors. So I'm from a really musical family. Both parents are from musical families. So, music has been around my life ever since I was a child, probably even in utero. My mum was a singer. My dad was a saxophone player. They met in a band, and Yeah, music's always been around. I loved music when I was in school, really loved, practicing my instruments. I was one of those kids who were never forced to get their practice in. I just really enjoyed it. And yeah, it's always been around, and I've always, connected with lots of different types of music. I've never been kind of pigeonholed into one genre. So I've always been fascinated by music anyway. So yeah.
And I was listening or watching your TED talk and you sharing the story about turning 18 and just wanting to go out and dance all night. And it wasn't the sweaty bodies that attracted you. It was the fact that you're moving your body to the music and in beat. And it was just fun with being with your friends.
Yeah, and there's something amazing about how, music just brings people together. It's, this universal language that you don't even have to know the lyrics to the same songs. Just if there's a solid beat, everyone just starts kind of moving together, and it's this universal feeling which we don't even realize we're engaging with, which is pretty cool.
And I liked how you shared the story about your grandmother asking you whether you knew the waltz or the tango and all these sort of dance moves. And you said, I don't know any of them. And she goes, show me your dance moves. And you had to cut and groove.
Yeah, just jumping up and down, up and down. That's all we kind of did when we were 18 going out. And I wish back then, I think many of the girls my age were wearing, high-heeled shoes. I wish I was in the generation of now where sneakers are fine. I'd probably have a bit more dance moves, but that was about, a while ago now.
100%. So just on to, I guess, your profession and, where you're shining and helping others in such a great way. Let's talk about music therapy and how it actually works. So how does music therapy rewire the brain?
So I think it might be good to backtrack a tiny bit just to share that in the context of Australia, to be a registered music therapist, you have to engage in there are 2 Masters of Music Therapy programs at the moment. So most music therapists are masters trained, and then we register with the Australian Music Therapy Association. So that might be helpful if people haven't really heard of the profession. And there's a lot of amazing evidence-based practice that is emerging from Australia actually and around the world. But when it really comes down to it, when you're thinking about rewiring the brain, essentially, the amazing thing about music is that it's processed in both hemispheres of the brain, so all over the brain. So if there is a challenge or disturbance or damage in one part of the brain, music can actually help by overcompensating. And that's why it's really great for working in particular areas such as stroke, where there is a brain injury in a particular part of the brain. So music might help with speech rehabilitation, movement rehabilitation. And another aspect as well when we think about music in the brain is that, you may have actually come across some beautiful clips on social media and YouTube and things like that of people, who have dementia and they're not able to say words or speak, but they can sing. And then all of a sudden, after they sing these songs, they can actually reflect upon the memories from that time. And the reason why that is possible is because music is linked to our autobiographical memory. So we actually tap into this part of the brain that is still intact, and because it's processed everywhere in the brain, it can actually help people kind of come out a bit more.
Wow. And I watched that documentary on the ABC, and it was looking at using music therapy for those with Parkinson's. And they took us through a study during that documentary. And I thought that was amazing in terms of how these people that really struggled with movement, that once they started this music therapy, their body just started to move like it, like it would, like it should.
Yeah, and actually with Parkinson's as well, a lot of that links to, that I guess that anecdote I offered at the beginning of my TED talk about, everyone just kind of jumping up and down to the beat in sync with one another. In music therapy, we refer to that kind of synchronization as entrainment. And when we're working in Parkinson's, many of us really focus on the importance of rhythm and beat to help people with Parkinson's, entrain or synchronize to the beat. And that has shown to have great benefits for kind of even activities of daily living, whether they're walking from point A to point B, or whether they are getting faster at that walking, or just sequencing their movement a little bit better to have kind of more safer walking. It all comes back to that kind of synchronization of the beat and the rhythm.
And when we're in synchrony with the beat and rhythm, does that elevate dopamine? Is there direct, have you seen evidence of that?
Off the top of my head, I comment on that, but I will say that because a lot of the kind of entrainment or synchronizing processes are linked to familiar music, I would say yes, for sure, because we're not just using, as a music therapist, people often ask, what music should I listen to? And the response is whatever music you want to listen to, actually, because music is linked to our memory. So when we listen to music or engage with music in our music therapy sessions that are linked to particular positive memories, then for sure that's going to make us feel good about ourselves in the moment. So that's something that I did a lot of work with when working in Parkinson's groups, asking them, what music do you like? And using that music in a more rhythmic way, whilst they also engaged in perhaps singing, which is actually quite difficult to focus on two things at once if you're someone who is at a particular stage of their Parkinson's diagnosis, but also because it was a group experience, they were also really kind of getting that energy or that vibe, if you like, off one another, and it was a shared experience as well. So there are kind of multiple levels, like the rhythmic element makes it easier to kind of follow and then have successful output. Then the familiar music aspect also brings them back to their memories and, the positive experiences they had. And then you've got the group element where they're actually, creating new experiences with people in a really relatable way. So lots of different levels there.
Yes, I can also see how oxytocin would be also, in a way, potentially elevated with that feeling of connection and doing it
Yeah,
with others.
for sure.
Yeah. So it's incredible in terms of how it can really help our mental health around boosting certain neurotransmitters, just simply by playing music that we relate to, we associate good memories with, and that bringing up those memories for people that are struggling to recall past memories with dementia, and then, as you mentioned, with Parkinson, starting to help prove that movement mobility with those with Parkinson. How do you work with those that have suffered a stroke? Because in the TED talk, you mentioned that 1 in 6 people globally are affected by stroke, and I can certainly relate to that in my family. My mother's had a stroke. My grandmother had a stroke, and just recently, last week, a friend of mine in the Philippines, her brother had a stroke. So it's all around us, and people are, families are grasping with it. As you said, it not only affects the person that has the stroke, but also those around it, witnessing loss of mobility, loss of function with that person, that loved one.
Yeah, music therapy and stroke, I think, is a pretty incredible. I mean, I refer to it as a superpower, music therapy in the context of stroke, because for stroke survivors, more often than not, they have multiple needs. It's not just, let's focus on getting your hand a bit stronger. Along with that, it's normally a speech challenge, a cognitive challenge, walking, a sense of identity or reformation of identity. And then, especially with some of the younger stroke survivors that I've worked with who are, from their kind of mid-20s to late 40s, there's this shift in kind of relational dynamics with their partners as well, where the partners also become the carer. And so there's lots and lots and lots of levels going on. And the reason why I like to position music therapy as a superpower in the context of stroke is because music therapists can actually draw upon multiple goal areas at the same time in one intervention. And though we may not be as knowledgeable as hand rehabilitation as an occupational therapist or a physiotherapist, we can actually engage the person in hand rehabilitation-based exercises whilst looking at identity, reformation, and self-expression at the same time. And that's something that I did in my PhD intervention, looked at hand rehabilitation and well-being at the same time, because from my clinical experience, I found that it wasn't just the trauma, the neurological trauma of the brain. It was also the psychological trauma of the stroke survivor grappling with this new sense of self, and also for many people that I worked with, not wanting to even acknowledge that they had had a stroke whilst recognizing that they had had a stroke. And for many of us, I hate to use the C word, COVID, but for many of us, we now have this interesting shared experience of what it feels like to feel isolated, to feel removed from society, to have kind of lower energy levels for initiating things because of this shared experience of COVID. And that's something that, might be relatable for your audience to think about for a stroke survivor. They feel trapped. They feel like they're not themselves. The motivation is really hard to initiate doing anything, which impacts their ability to actually have changes in their physical outcomes. So that's why I focused on well-being and hand function at the same time. And in this intervention, the stroke survivors engaged in using an accessible music-making application called Thumb Jam, which I didn't create. I just used a lot in my practice, so they didn't have to have much movement to engage with it. And because they were actually making music whilst working on hand exercises, they were engaging in what we refer to as non-verbal self-expression. They were just creating music. I was accompanying them on the guitar most of the time. And then we had more focused exercises like learning an excerpt of a familiar song. And we found that in their reflections through the qualitative analysis, there was some shift in their experience of anxiety in that acute setting, and there were some improvements in hand function. But this study happened during COVID, so we didn't get the numbers that we wanted, but it was a really exciting kind of first step to learning a little bit more about, how we can make intervention more accessible for people, and also looking at multiple things at the same time, which is very common in the music therapy space.
I really love that holistic approach that it has in terms of, as you said, you're not only helping with that physical function, you're also helping with that rediscovering their identity and connecting with their identity through that, allowing them to express themselves through music. Do you find that the music they choose initially is different to where they go to over the course of treatments? Like, do you find that initially that music may be associated with some denial or some, a bit of anger about, to themselves or to someone else about, what's happened, and then they move through that cycle of, going through that, I guess, grieving cycle. Do you find that?
Yeah, I think it depends on the level of injury as well, I suppose. So in my particular study, the stroke survivors basically had limited to no hand function at all. So I should mention I combined this music making method with something called functional electrical stimulation, which is a method used by physios and occupational therapists. So when I actually met these stroke survivors in that recruitment phase of my study, many of them were just kind of saying to me, I'll try anything at this point because I just need to know that something can happen. Whereas when I've worked with participants who have had more presenting movement, and it is more that the goals are more focused on the kind of psychological, motivational aspects of their recovery, often I find that, I guess from an anecdotal clinical experience perspective, there is less receptivity to kind of really engaging, then there's more engagement, and then, working towards kind of self-directed engagement. So with the more engagement perspective, I suppose what I find really fascinating as a therapist is when the stroke survivors or any of the participants I work with actually go deep into the challenging aspects rather than, oh yeah, I like this song, let's sing it. Because then they're finding music that actually meets where they are. So it might be a type of music or a particular song that might be, in quotation marks, depressing, but having a music therapist there support them in engaging with that listening process, whether they are crying in the process or not, really validates their experience and meet where they are, rather than trying to make the person feel happy when they're on this end of the spectrum, really not happy. When you try to make someone happy who's on that end of the spectrum, you're going to do more harm than good. And I guess that kind of links to some of the incredible work by Professor Katrina McFerrin, which looks at the healthy and unhealthy uses of music. So remember, we can use music in a really unhealthy way. We can downward spiral if we don't have the knowledge and skills to move through. So it really does depend on the individual, but I would say that the most kind of deep, I suppose, sessions are when the person actually allows you in and shares all of the challenging stuff, and it may not be appropriate to shift that perspective but in that moment, but then at least you can validate for that continued shift, for that sense of identity. So sorry, that wasn't a very straightforward answer, but people are complex.
100%. I totally understand that everyone's unique and different and special in that sense. So, each case is a separate case, and you just work with where the person's at and take them through the process. And that's, I think, what I gather from what you're saying. Depending on where they're at, that's how you progress them forward. And people move through that at different rates. Some people a bit slower, some people a bit faster than others, but you're essentially progressing, making progress with their mental health, and the acceptance and acknowledgement, and tapping into their unique superpowers.
Yeah, and what I find really interesting, because I've worked in pediatrics and across the lifespan in stroke, and it often, people are often really shocked when they learn about the fact that children and babies can have strokes as well, because the media kind of focuses in more on the older population. But working across the lifespan, I find it really fascinating to see how people at different life stages, their level of motivation. And one thing that, again, anecdotally, that I've really learned from these wonderful stroke survivors is the importance of the supportive network. And I found that people who generally have more support in their life, their everyday life, feel more motivated to engage in, this way of this therapy, self-directed, so beyond the therapeutic session. And one particular person I worked with, he was about 32 when he had his stroke, really, fit, working professional, lives with his partner, and wasn't interested in music, but wanted to give it a go. And he had some really incredible outcomes, and, was able to drive by the end of, the program finishing, was able to write his name, return to work, was able to iron his clothes, all of that kind of thing. And one thing that I found was really interesting in his sessions was that his brother and his partner would come to every single session. And that was something that was really important to him. So that supportive network, whatever end of the lifespan, I think as therapists and people working with people who have complex needs, be really attuned to if people have supportive networks, and if they don't, what you can do from an equity perspective to support that and build that as well.
Yeah, it's that's such an important point, is that having that support network, because progress needs to happen beyond the session. Otherwise, in essence, life will get in the way, and you'll go back to your old ways, and you'll sort of take one step forward, two steps back. And I can see why, when you had the whole family there, that if he was, back into the real world and, taking on the challenges and facing new obstacles, because obviously once he was able to, potentially walk up a set of stairs, and now that's a bit more difficult, or he needs to do it with assistance, and that's, it hits him in the face again, and reminds him of what's happened. And but having someone there, or the carer there with him, that's really supportive, can, I guess, take that, caring, supportive role during those times, and keep him moving forward. Have you had any other cases that really stood out in your career?
I mean, so many. I'm just trying to think of which ones to share, I suppose. I've been really fortunate to do some long-term work with some young people. So I met him when he had a stroke when he was about, I think, 11, and I'm still working with him now, and he's a teenager. So this whole, when you're in your adolescence, your transition into your new sense of self and identity is really interesting. And with this particular young person, what I have really learned is the way that he speaks about how he had a stroke. It's really shifted my understanding and approach to working in stroke across the lifespan, because the way that he talks about stroke, remembering about how he had the stroke when he was 11, is very different to how, 32-year-old talks about having had the stroke versus, an 84-year-old talks about having a stroke. And I feel very inspired by this young person because he transitions into talking about how he had a stroke and it was very scary, and now he's really strong. And, the strength that he's talking about is his physical strength. We did a lot of work on hand rehab and speech rehab. But what I really see across that lifespan that I've worked with him so far, and through kind of teenagery, shifts, which is a really complex time for an individual, is his inner strength and how he's advocated for himself in his various school settings, how he's kind of found his sense of self. He told me in a recent, we do a lot of songwriting together to help with just word finding and also that emotional expression. And in a recent songwriting experience, he reflected upon how he wanted to, when he finishes school, he wanted to be a nurse and a music therapist. And it was just, so hard to not get teary in the session because that's what he remembers from when he had a stroke. You never realize, whatever discipline you are, you never realize the impact you'll have on especially children who are kind of getting to know who they are. And so I was very, I'm very inspired by him for sure. But along with him, there are so many people I've worked with, and there's another particular stroke survivor who I remember telling me, and I think I referenced this in the TED Talk, who had shared that they felt like they were half a person after having the stroke, which is a really, when this person said this to me in a session, I remember just feeling my heart sink. And though that isn't a particularly uplifting comment, it's a real comment that I'd never heard before. So when I heard this from this person, it really shifted my practice as a therapist and made me even more cognizant to not just try and, make people feel happy, to really meet where they are. And I've drawn upon that quote, the importance of lived experience is, I prioritize that more than clinical experience, because you need to connect with people, of course. So when I'm working with stroke survivors who are in a really, really challenging part of their journey in recovery, I may say something like, look, I've never had a stroke myself. I don't know what it feels like to go through that. But I had worked with a stroke survivor who shared with me that, they felt like they were half a person when they were in this phase. And I cannot tell you how many stroke survivors have connected with that since, just from that comment of, lived experience and validating that this is not great. You can feel motivated and get better, but at the end of the day, it's a really challenging time. So, kind of coming back to lived experience as well, from the kind of uplifting, exciting perspective of the young person, but also from the challenging perspective of the older person too. That's shifted my practice a lot.
It's amazing how clients often progress us as clinicians, therapists. Yeah, it really is. Like I once, heard that saying that, when the student's ready, the teacher appears. But then I've also recently heard the reverse of that saying: when the teacher's ready, the student appears. In the sense that when the teacher's ready for their next level of progress, then that student comes and challenges them to go to that next level of progress. So
totally agree.
I found that my personal clinical practice, and I could hear it, in terms of what you're saying, and I thought, wow, I can relate to that. It's quite profound.
Yeah, and I think we've always got to keep learning from the people that we're working with and that we're supporting, because at the end of the day, as therapists, we're working for them, so we've got to find that nuance and find that shift. And half the time it really challenges maybe what we learned at uni, or the particular technique that, we're supposed to make a big difference, but it's not working for that person. And that's, part of being a clinician.
100%. So I was thinking, like, you work a lot with, some of these really debilitating, or, that have such a big impact around mental health, I guess, disorders or diagnosis. What about the lesser sort of? I mean, it can be it's quite debilitating. Chronic anxiety and chronic depression. You can also work with those people?
Yeah, so actually, my early in my career, I helped establish an ongoing mental health program in a couple of hospitals, which are now government funded, which is very exciting. And that was in acute mental health, and that actually inspired the way that I work in neuro rehabilitation. That's why I have a huge mental health aspect to my neuro work. But in my mental health work, and there's heaps of amazing music therapy research about music therapy and mental health or mental ill health. And I guess one big thing that I learned about in my work there was, again, the importance of connection and lived experience, but also the importance of processing. So in my work in mental health, I was predominantly working with people who had some challenges with addiction, so very substance abuse, and then also with people who had quite a diverse array of diagnoses as well. But back then, this is going probably about 8 years ago, we were creating a new program, and so we did like this open group thing where people would just come together, and it would be kind of an array of people in the space. And what I found worked really beautifully was using improvisation-based methods in music therapy, where we let the kind of instruments do the talking. So, I'd get particular instruments or program particular instruments so that when we played together, it would have it would feel accessible to engage with the people. And then I'd either play a guitar or a piano and kind of hold the space, if you like, so keep it grounded. So everything that was happening, it would feel okay for the participants. And then we'd have a bit of a chat about it after. And one thing that really, again, I learned this from my experience in the field, one thing that really shifted my knowledge was that many of the people who had experienced challenges with substance use said that engaging in these processes helped them feel like they were getting to that high that they had whilst on substances. So they found this alternative for this, the chemical hit. And then we actually created something more concrete after that, where we'd create a song with words and lyrics, which would verbally unpack what that means and kind of explore why they're in hospital at this time and that kind of thing. So that was my kind of intro to working in mental health, which has shifted, again, my practice. So even in neuro rehab, I use a lot of those methods across. But yeah, so I think in the mental health space as well, working with people one-on-one, there are lots of different music therapy methods and techniques that people draw upon to support that self-expression, but also to support, things like medication compliance, interaction with other people around as well. There's so many different methods.
Yeah, I can see how it could really work with someone that doesn't like the talk therapy, and how this is a great help and aid to support them, because, as you said, they're expressing themselves via a musical instrument, and it's allowing them not to talk, but to express their feelings outwardly through the music they're playing. And I was seeing parallels to art therapy, where they're expressing what's going on internally through pictures that you're drawing.
Yeah, and I've been very fortunate to work with a lot of art therapists actually in that way. There's a lot of art therapy work happening in the mental health sector as well, and it's a very similar process in that when you think about just people in everyday life, when you've experienced something really challenging, sometimes to talk about it makes it more real, and we don't always feel ready to talk about stuff straight off the bat, especially if it's a really challenging experience and we don't want to feel upset by it, even though we know that's healthy. We don't want to do it. But also for some people, the kind of other side of that is that they may be going through some stuff and they may not actually have the words or the language to articulate verbally what that is. So these kind of creative arts therapy processes become more accessible for that outlet. And with music therapy, I know with art therapy, there's often a kind of concrete end product if you're creating in particular art processes. But with music therapy, you may have an outcome that you can see, like we've written a song, but you may also have something that's just kind of left out into the ether, whether you've engaged in a musical process and it's there and there's no concrete, tangible thing to take away from it as well, which can also be helpful in those earlier sessions as well.
It's true that the only real thing they take away is the experience with you creating the music and how they felt in that moment creating that music. Yeah, no, it's been fascinating. I really appreciate you coming on the show and sharing all this knowledge and insight around music therapy and how it can help with mental health and help with the rehabilitation in terms of those mental conditions we spoke about, Parkinson's, dementia, and having stroke people. So I really appreciate you coming on the show, Dr. Silveira. So how can the listeners best connect with you?
You're welcome to contact me through my social media. So my Instagram handle is at Tanya Marie PhD. And for those of you who are interested to know more about how you can draw upon music in your work or in your practice, I'll send through my website for my workshops, which is tmsworkshops.com.au. So you're welcome to contact me through that as well.
Fantastic. And yeah, listeners, I'll include those links that Dr. Silveira shares with me in the show notes. So you can just go directly to the show notes, click on those links. And just my final question for you is, can you work with people remotely with music therapy? Is it something that can be applied remotely?
Yeah, so a lot of music therapists work through telehealth channels. So, I mean, this has been happening pre-COVID because, as you can imagine, actually there's, not as many music therapists as there are other allied health disciplines. So for me in particular, I do work via telehealth, and that has developed, I suppose, a little bit more since COVID because a lot of families have made the decisions, and of course the cost of living crisis, we've got to mention that as well. People are moving to more kind of less metropolitan areas, but they've wanted to maintain their therapeutic engagement. So many music therapists do work remotely. Again, it depends on the goal areas of the person, but I'm sure any music therapist is up for that as well.
That's fantastic to know because a lot of the listeners will be, remote from Sydney. So I just really wanted to make sure that you could help them if that was possible. And it's great that you can work with telehealth. It's really opened you up to working with, in a global sense.
Yes, for sure. And I think it's really important, especially thinking about, my partner's family are from a rural community, about 6 hours away from Sydney, and just thinking about, though they have, a main hospital, the access to various therapeutic services is very limited, of course, when you compare to metropolitan areas. So it's really wonderful that, you can link in with telehealth services, especially for rural communities, to have more access.
It's fantastic. It really is, because it's like, it's finding the right solution for the individual, as you mentioned earlier in our discussion. And like, if music therapy is for them, then it's them having access to that resource that's really going to help them. So it's really good for people to know. And the purpose of this podcast is to enhance and enlighten the well-being of others. And you've certainly done that today, Dr. Silveira. So thank you so much for coming on the show.
Thanks for having me.
You're welcome. Podcast disclaimer. This podcast and any information, advice, opinions or statements within it do not constitute medical, healthcare or professional advice and are provided for general information purposes only. All care is taken in the preparation of the information in this podcast. Connected Wellness Proprietary Limited, operating under the brand me&my Health Up, does not make any representations or give any warranties about its accuracy, reliability, completeness, or suitability for any particular purpose. This podcast and any information, advice, opinions, or statements within it are not to be used as a substitute for professional, medical, psychological, psychiatric, or any other mental health care or healthcare in general. me&my Health Up recommends you seek the advice of a doctor or qualified health provider with any questions you may have regarding a medical condition. Inform your doctor of any changes that you may to your lifestyle and discuss these with your doctor. Do not disregard medical advice or delay visiting a medical professional because of something you hear in this podcast. This podcast has been carefully prepared on the basis of current information. Changes in circumstances after publication may affect the accuracy of this information. To the maximum extent permitted by the law, me&my Health Up disclaims any such representations or warranties to the completeness, accuracy, merchantability, or fitness for purpose of this podcast and will not be liable for any expenses, losses, damages incurred, indirect or consequential damages or costs that may be incurred as a result of the information being inaccurate or incomplete in any way and for any reason. No part of this podcast can be reproduced, redistributed, published, copied, or duplicated in a form without prior permission of me&my Health Up.